billion Uganda shillings to get the resources we need. Again, the workers work for free. We don't pay them, so it's bonus service. But we need to feed them, to accommodate them, to transport them, so that money goes to those things. The team for workers is, we're estimating 580 workers. 580 workers. And that's what brings us to 580 rooms for 7 nights. And quick mathematics, the chair counted, and we get to 700 million. We just accommodate 580 people for 7 nights. So you see where the 1.5 billion goes. The period of time when we do surgery, it's in our protocol that we follow up the patient for 30 days. Anything that happens within 30 days is related to the surgery. So we have that. We have a mechanism for that. Remember, these 23 sites we're going to operate on has resident workers. So we are working with this team, and then we do the arrangement that whoever is operated, if they have any issue, they go back to that site where we operated them from. The name is there, the contacts are there, we know what we did, we'll be able to handle it if it arises. Normally the percentage is about 2% of the 2,500 will need to go back to sort out an issue of surgeries. And we have about 13 categories. I'll mention some, maybe not all of them. We will do neck surgeries for conditions we call thyroids or goiters. Those are normally many. We'll do hernia surgery. Hernia surgery is one of the top surgeries that people come with. We'll do surgeries for children. That falls in the category of pediatric surgery. We'll do surgery for bones, broken bones, unhealed bones. We call that orthopedics. We shall do that. We'll do surgeries for ear, nose, and throat. We call it ENT. We'll do eye surgery. Actually, we've lined up 600 patients with cataracts. We'll do those, and we'll do other things that they call endoscopy, checking inside using tiny little instruments. So a whole range of surgeries. And we have about 13 categories. I'll mention some, maybe not all of them. We will do neck surgeries for conditions we call thyroids or goiters. Those are normally many. We'll do hernia surgery. Hernia surgery is one of the top surgeries that people come with. We'll do surgeries for children. That falls in the category of pediatric surgery. We'll do surgery for bones, broken bones, unhealed bones. We call that orthopedics. We shall do that. We'll do surgeries for ear, nose, and throat. We call it ENT. We'll do eye surgery. Actually, we've lined up 600 patients with cataracts. We'll do those, and we'll do other things that they call endoscopy, checking inside using tiny little instruments. So a whole range of surgeries. Gynecology for fibroids and things like that.
My last
12 districts and Arua City. So we'll be in Pakwach, we'll be in Zombo, we'll be in Nebi, we'll be in Koboko, we'll be in Madiokolo, Terego, we'll be in Ubongi, we'll be in Adjumani, we'll be in Moyo, we'll be in Yumbe, and Maracha. So we really look forward to coming and bringing these specialized services to you. But in addition to the curative surgical services we offer, we also have a component of school health screening. We will go to 12 schools in this region, both primary and secondary schools. We'll be screening for musculoskeletal deformities, we'll be screening for dental problems, hearing problems, eye problems, so the teams will be in the schools. And also breast cancer and cervical cancer and prostate cancer screening will also happen. So you will find that so many kids are having issues with performance in class, but basically because they can't hear or they can't see, or unneeded glasses probably, and this would really change a lot. So we really call upon all of you to support this great initiative. As our legislators have mentioned, it will take us about 15 years to go back to this region, so we want to make maximum impact.
Next month from the 20th to the 28th of September. Indeed, we did receive the brief from the President, and the President did make a request to us, the members of the West Nile Parliamentary Caucus, and to the whole of government and society to support this noble cause. The key points from our conversation is the population that will benefit from this surgical camp. West Nile as a sub-region has close to 4 million people. And about 1 million of these are refugees, mainly from South Sudan and neighboring countries, including migrants from South Sudan, Central African Republic, as well as the Democratic Republic of Congo. The population is generally grappling with the double, if not triple burden of diseases, infectious diseases, diseases of lifestyle, as well as outbreaks that have been occurring and affecting the people. We therefore do appreciate the gesture of the Association of Surgeons of Uganda to take specialist services to the 13 administrative units and local authorities of West Nile. This surgical camp will be hosted by a number of health facilities that the President of the association will be able to provide us more details on, and for the camp to be able to succeed, it requires resources. And these resources have to be mobilized by us, starting with the members of parliament, the leadership and stakeholders in West Nile, and friends of West Nile, including ministries, departments, and agencies. What are these resources required for? Specifically, the resources will help us be able to transport the surgeons to the facilities that have already been accredited to provide services to the citizens in the Arua City and the 12 district local governments. The team of health professionals will also require accommodation in terms of hotel rooms for about 580 specialists, healthcare workers that will be in the region.
The one in the hospital called Abere Hospital in Oyam district. But now I am proud to say, as a member of parliament, that we have, and of course when you have a CT scan, the surgeons are able to do their work. They would know where their clots, they would know where if there is intracranial bleeding and so many other issues. Border accidents, all these, as long as you have head injuries, you need to have a CT scan. In Arua Regional Referral Hospital, we now have a new blood bank. It was commissioned early this year by the Right Honourable Prime Minister. That's another milestone for the people of West Nile. So it's work in progress, and we are getting there. I'd like to assure the people of Uganda and West Nile in particular that Rome was not built in one day. But as a member of parliament, as a medical doctor, I can clearly see that there are improvement in a number of these indicators. So I would really like to urge the people of West Nile, the district health officers, to ensure that we have been able to select quite a substantial number of patients to come in the areas of orthopedics, ENT, ophthalmology, cardiothoracic, and we are now bringing the best surgeons to the region. Usually it's people from West Nile leaving West Nile coming to Kampala to seek for these services. So that 480,000 that the President is talking about is a paltry fee. If you look at, under ordinary circumstances, somebody having to jump onto a bus coming to Mulago for some of these surgeries, the waiting time, the duration they spend in Kampala, this is really a very small figure, and I'm very glad that we shall accomplish this objective. And I would like to urge government that in the near future we could put this as a recurrent expenditure. in our budget so that every year, whichever sub-region it goes to, the association does not have to go and start doing fundraising. This becomes a recurring cost.
of health. In the last 2 or 3 financial years, there have been attempts to put budget specifically for surgical camps to cover the regions, the half of the whole country. What we are going to do, we are going to continue advocating and pushing government to see that the Ministry of Health budgets